Hello everyone, my name is Arav Shapathi.
Hi, I'm Shukla. I'm an internal medicine physician.
So today's topic is insomnia. So, Dr. Shukla, what is insomnia?
Insomnia is a symptom which is primarily lack of sleep. It could be problem initiating sleep or maintaining sleep.
Okay. So what are the common causes of insomnia?
So medications are by far the most common cause. So
Okay.
being habituated to a medication can cause insomnia. Daily alcohol use is also something that makes your brain used to having alcohol in the system, and over time individuals can experience withdrawal insomnia, or even in the presence of alcohol it might not be enough to put them into sleep. And you can expand that into any sedative like your Benadryl, over-the-counter sleep aids, or even allergy medications. Cannabis is also linked to insomnia because it can, although in the short term it helps with anxiety, in the long term it can increase anxiety, thereby promoting insomnia. So there's some correlation there. Anxiety being one of the conditions that are linked with insomnia as a symptom. It's fairly common. So those are the things I'm screening individuals for when they come into my clinic, is if there is a primary anxiety syndrome or some medications that they're taking either over the counter or prescribed. And then sleep apnea is a medical condition where your airway, particularly the upper airway, stops exchanging air, so you're choking all night during your sleep. So even though the mind is asleep, the brain is asleep, the body is fighting, and it can wake people up. It doesn't always wake people up, but that could be related to poor maintenance of sleep, or waking up like you never slept, or feeling like you did sleep 8 hours but like you never slept.
Right. It's good to know. How does age influence insomnia and like sleep patterns?
So anxiety, so depends on the underlying factors. So anxiety can happen in younger age groups, but as we advance in age, there's more likelihood of obstructive sleep apnea, and individuals over the age of 65 are usually on medications. Close to 75% or more are on more than 2 medications. So that predisposes them to insomnia.
Okay. What are the medications for insomnia?
So based on the guidelines from the Sleep Medicine Association, medications are not the first line. The first line treatment for insomnia is cognitive behavioral therapy for insomnia. So that would be the main treatment. And of course, looking for underlying conditions. So if somebody has sleep apnea, treating sleep apnea with the CPAP would be the solution, or treating anxiety. Common off-label treatments are used, like trazodone is one of the anti-anxiety medications, antidepressant, which is very commonly used for insomnia because it does have a sedative effect and it's a weak antidepressant. So it's a very, very commonly written prescription for insomnia with a tolerable side effect profile. So you'll see a lot of patients being treated with insomnia by using trazodone. However, that's not FDA approved use. There are many newer agents called DORAs, and doxepin, another type of antidepressant. These are not very commonly prescribed. These are controlled substances with abuse potential, as in habituating. People who start taking them they're at risk for abuse potential, as in needing them even though their primary problem is solved, or using them in manners that are not prescribed. And back in the day, doctors used to give sedatives very commonly, but we found that they set you up, just to name a few, would be zolpidem, lorazepam, Ativan. We found that those predispose you to more insomnia in the long term. And are also linked to dementia and early death. Falls and spillover cognitive effects in the daytime, so more somnolence, fatigue, brain fog during daytime, impairing individuals' activity during the day and making it risky for them. Particularly as we advance in age, those side effects become more prominent. So individuals could be taking lorazepam for the sleep problems for their entire middle age, 40s, 50s, but as their body changes in their 60s and 70s, they might start to experience side effects at the same dose. So there's tolerance. The same dose is either not effective or the same dose can have side effects. So age matters a lot with medications, which we don't want to use in the first place.
Yeah, right. That's interesting. That's it, yeah.
Oh, okay, I'll add a little bit something about sleep. So we talked about cognitive behavioral therapy. There are sleep medicine doctors who deliver that therapy, changing some of our thought patterns of how we think about sleep. There are some self-help apps that you can just go into the app store and download, and they'll coach you through some of the therapy you can do on yourself. And then sleep hygiene is very, very important. Very easily dismissed or taken for granted, but those little things that you can do proactively can prevent sleep issues or nip them in the bud. The longer the sleep issues go, your body is just catching up. There's sleep debt, which is very hard to catch up. So your body's always playing catch up and you never feel good. Therefore, if you find yourself experiencing sleep problems, it's really important to act early.